Welcome to Dyspraxic Rosie Writes, a channel where we talk about dyspraxia, chronic illness, and the writing life. Something that I noticed when I started to check my analytics as I started to slowly post more and more videos on YouTube is that despite me being Canadian myself, that I have quite an international reach, that if anything, a lot of the interest and the curiosity about what I have to say comes from other countries, which is amazing, but actually a very low percentage are Canadian in terms of the analytics themselves. But I really wanted to take a moment to help people understand what it is truly like to be dyspraxic and Canadian in the event that they either make Canadian friends within that community or consider moving or working with Canadians within this niche space of neurodiversity and disability in the future. Overall, I'm going to focus on 3 pros and 3 cons, although I would argue that both the pros and the cons alike in this situation have both their upsides and the downsides, and I will explain that in more detail in a minute. And yeah, now that I'm back in Canada for a couple of weeks, this is very much something I've been reflecting on and considering in terms of how this has affected my life experience as an individual. The first one I'm going to mention is that of healthcare. I would say that this is a layer that, in comparison to our American peers, adds marginally less stress to. We have a system that is technically a public system. UK viewers will recognize some similarities in terms of the NHS, in a sense that it is something that everyone can access and not have a fully insurance reliant system, but it's not 100% the same. For instance, if you don't have insurance through your work, things like dentistry and Pharmacare are still not covered yet. And even things like occupational therapy and physiotherapy, which are very much life-changing sort of services and healthcare facilities for dyspraxic people to access, you don't have any guaranteed access to that through public systems. There are some community postal code reliant community health centers, which basically just mean that if you live in that area, you have access based on where you live to some of these services. But the unfortunate reality is that that is only a select few communities, often urban. Therefore, that's not really a promise or a guarantee necessarily. But, it's really not all that bad. There's when you can get in. Post-COVID, what I know is that, unfortunately, it's not easy to get an appointment with a doctor or specialist without a lengthy wait. Like, there are so many situations where you will be waiting and there will be the stress of waiting, and you always have to factor that in as a part of things. And yeah, once again, that's something that I think my peers in the UK will relate to as both like a good and a bad part of things all at the same time. Another thing within the Canadian system that I think is pretty good, but once again, this is something on the pro and con list that I have to say is dependent on what you can access within your school system, depending on where you live, and even if a diagnosis in the first place is accessible, which is really not a promise or a guarantee anymore, is that of special education. I would say that a lot of the special education resources within Canada are fairly good. I would say, as someone who grew up accessing it, that was one of the most life-changing things to have access to. Just to know early on and have the practice early on of being in a setting in which you have to stick up for your needs. And as you learn, as you grow, as you develop that language for sticking up for your needs and your accessibility needs, you have a whole support ecosystem around you of people who can help you develop that language and figure out what you do and don't need, and make sure that your support needs are being respected. But it's definitely not perfect like the healthcare angle. It requires a formal diagnosis. Therefore, certain groups and communities, especially rural communities, people that are from the LGBT community, people that, in many cases, women are some of the least supported, are less likely to be able to access this form of useful support, just because they're less likely for their support needs to be recognized. But that's one of the things that, if you can access it within Canada, is absolutely phenomenal. But we have a lot of work to do for it to really support as many people as possible, regardless of their background, income, etc. Another thing that is one of the advantages, but yes, once again, this falls under the category that is necessary to mention of if you were able to access it. I would say that really overall, the financial social programs within Canada are really not that bad, but the real issue with them is, in many cases, they don't provide enough support. In many cases, they're not high enough dollar amounts to make a difference, and you have to jump through a lot of bureaucratic hoops to access them. But when you can access them, they're fairly good. Ever since I finished university, I was thrilled to find out that we went ahead and developed a program within Canada that is similar to what disabled students in the UK have, in terms of a grant program for university students for filling the gaps in access to programs around things they need to have an accessible learning environment in order to fill some affordability gaps. And then there's things like the Registered Disability Savings Program. My spouse helped me set that up not too long ago, and it is such a great thing to have access to if you're in a position to develop the savings within it. It is a whole investment and savings program specifically for people with disabilities within Canada. And I mean, we do have the concept of being on disability within Ontario. We have provinces here, which are kind of like the American states. And there are similar sorts of things within Canada. And that's a whole topic for a whole other time. I think we have lots to improve upon in terms of making that a whole lot better and a whole lot more accessible for people and also filling the gaps in terms of a rise in cost of living. Many of the amounts that people get who are on disability are not enough to cover their living expenses for what the rise in cost of living is now. So we've got a long way to go on that, in my opinion. So let's move on to the cons part of the list. Although the pros, I also had to mention the bits that weren't perfect, to be completely honest. So the first one I'm going to mention in the context of being dyspraxic in Canada that can be a real source of frustration for people is that of the fact that we have no local charities, no local not-for-profits, and no local resources for dyspraxia in particular. Many of the equivalents that you can find are things that are for neurological conditions just in general, and general research for neurological conditions rather than just specifically dyspraxia. During Dyspraxia Awareness Week, I did hear about something called DCD Kids. Although the fact that I hadn't heard of them before, I mean, this is no slight on the people running it, said a lot, because I'm very much plugged into a lot of the charity space around this internationally. And they seem to be running a lot for just kids. And in my opinion, in order to offer enough support, we need lifelong supports. We need young adult programming. We need programs for adolescents. We need programs for adults in order to support them through all parts of their lives. And this very much means that what a lot of dyspraxic Canadians have to turn to is research from other countries, resources from other countries, and charities from other countries as well. The last point is kind of on a similar note, and that's the fact that this is more a note on how I feel about how a lot of accessibility conversations around disabled people in Canada specifically are handled, in a sense that there is this pride in the existence of feeling like you're making certain facilities, from airports to events to things like that, accessible to disabled people. But there is always bits that are left out of the conversation. It's more likely to be about how can you support people in wheelchairs. But even then, I always find that even though the people who are brought on to make these facilities more accessible are doing their best, and they're always very kind-hearted and hardworking people that are trying to help as much as they can. Many of the initiatives around supporting disabled people, making spaces accessible, are often, it really shows in the results that they're definitely insufficiently funded, definitely understaffed, and definitely underprioritized. They're almost an afternote of sorts of ticking a tick box rather than going through and treating disabled people with full dignity and taking the time with them and treating them like contributing members of society with respect and dignity as much as possible. That's an ongoing source of frustration for me. Hope you enjoyed this video, and hope this enlightened viewers outside Canada, within Canada specifically, on what being dyspraxic within Canada is like further. And I would love to hear in the comments section, what have your experiences been like with navigating dyspraxia or other neurodivergences in your country? What do you think is done well, and what do you feel can be improved upon? Hope you enjoyed the video. Like and subscribe. Happy reading, happy writing, my friends.